Well, Toronto's SickKids Hospital is putting forward updated recommendations for reopening schools safely. SickKids has partnered with other child health care providers around the province to deliver a report outlining key areas of focus for the fall. They include an increased focus on epidemiology, additional discussions on the benefits and risks of masks, and guidance of physical distancing in schools.
We support the goal of getting children back to full-time school and feel that this should be a priority for our provincial COVID recovery. How to operationalize this goal may be different for different aged children and those with physical, developmental, or mental health challenges, and should depend on the local COVID epidemiology at the time.
And for more, I'm joined by Dr. Jeremy Friedman, Associate Pediatrician in Chief at SickKids and co-author of the document. Thank you so much for joining us this afternoon.
You're very welcome.
All right, so can you walk us through the highlights of the document's recommendations for how schools should prepare?
Well, it's really just a revised version of what we came out with a couple of months ago, mainly to reflect all of the new things that have been learned in the last 6 weeks through both new research as well as experience from other jurisdictions opening up schools in various parts of the world. And in addition, we got a lot of feedback after the first set of guidelines that we put out, really constructive feedback. So we tried to really incorporate a lot of that and engage with many other partners across the province to try and make this document as helpful as it possibly can be.
Mm-hmm. And should masks be mandatory for all teachers and students, whether or not physical distancing is being practiced?
So masks it's such a complicated, nuanced issue. Certainly, it's not a one-size-fits-all. You know, certain children in elementary school are different from children in high school. The recommendation will be a little bit different depending on what the level of COVID infection in the community is, whether you can achieve appropriate physical distancing. So the gist of our guidance is certainly for high school students and probably for middle school students as well, when physical distancing cannot be put in place, then mask wearing would probably be recommended. But for elementary school children, we're hoping that we can manage without having to have them in masks, if at all possible.
Mm-hmm. And Jeremy, what about classroom size? Should they get smaller? Should the students be spread out? What's the right thing to do here?
So as we know, just from what we've heard from public health, physical distancing is an incredibly important part of stopping the spread of COVID-19. So ideally, we do recommend 2 meters distance between particularly high school students in classrooms. And, I think obviously the operationalizing of this is the tricky part, but we're hoping that folks can get creative and can be resourced and can use whatever spare space or creative space they can find to, wherever possible, achieve at least a 2-meter physical distancing in the classroom for the older kids. For the younger kids, because they spread a little less effectively, it might be that a physical distancing of 1 meter between children might be acceptable. It still certainly provides protection, although probably not quite as much as 2 meters separation.
Mm-hmm. And what about the students' mental health? Is that also at risk if the in-person classes don't resume in September?
Yeah, I think that's one of the things that really worry us. We're completely supportive of having schools closed at the time when the pandemic was initially hitting the community. And that can be managed for a few months, but this is going to go on for quite a while. And there is every indication that even after this period of time, children and families are really reporting incredibly increased incidents of whether it's anxiety or mental health issues, behavioral irritability. There's so many things that are cropping up that it's really not sustainable. So we're pretty desperate to try and help children and families get back to school in September, 5 days a week, in as safe a fashion as possibly can be achieved.
Yeah, and get the kids back in a routine. Well, thank you so much for that, Dr. Jeremy Friedman, Associate Pediatrician in Chief at SickKids and co-author of the document. Thanks again for your time.
You're very welcome.